Post-surgical care, after some form of a surgery you are going to, it depends a lot upon what type of surgery are you going for. Is it a minor surgery? Is it a major surgical event? Is it done under local? Is it done under general anesthesia? So all these things will matter. Plus, how long will the hospitalization itself will be, indicating what is the type of surgery that they are going for. 5 Ps are generally when visiting nurses come to the house after a major surgery. What they'll be looking at is, number one is pain indication. They have some form of a quantitative assessment. They can give a numbers 1 to 5 or something like that, or show some diagram of a face. So pain is one of them. So pallor is another there, because post-operatively hemorrhage is always a possibility. How much blood have you lost during surgery, or there may be other bleeding issues that may be happening after surgery that is not visible to the outside. So they are anemic and they will look pale to the skin and the conjunctiva. So paleness is another one. The other one is if you have some extremity surgeries done, you will see some paresthesias, numbness, tingling feeling into the feet, or depending on what nerve endings, what nerve areas you may have worked in. You may be hematoma, there may be some damage to the nerves. So you look at paresthesia. And there are also sometimes paralysis, which is another P. So whether the muscles are getting weak. So these are important clues that you pick on early than later. Depends on what kind of surgery. If you are talking about an extremity surgery, like it also changed over a period of time. Like a few years ago, 10, 15 years ago, you had a knee surgery, knee replacement. You had some therapy for 2-3 days and you never walked until at least a week or 10 days. Now, post-op knees, we are walking next day. Same thing, hip, and same day. Actually, same day, once you're out of the anesthesia, you can walk. Even people who had open heart surgeries, we started ambulating them day 2. Sometimes, depending upon the surgery you have, you don't want to, if you are in an abdominal surgery, you don't want to put too much pressure on your abdominal muscles, like getting out of the bed without any help, because you're putting a tremendous pressure on the stitches, and the outside stitches may have healed, but there are inside stitches which will take a longer time to heal. So you want to give that 10 days time. Fever is one of them, but there's a number that you want to look at. Just having 99 technically may be called fever, but it's really not what we are concerned about. 100.4, because there is some form of a febrile reaction to the, not to infection, but to inflammation, because it's a major surgery. You have cut through a lot of organs and tissues and muscles, tendons, ligaments. So that itself produces a certain amount of inflammation from the cytokines that are released. So that produces a low-grade fever. So anything above 100.4, surgical incisions, always we worry about infections, because there is a certain percentage of post-operative infection rate depending on the type of surgery. Whether you have abdominal surgery, whether you had gallbladder opened up, whether you had a viscus that has burst and you are going into a viscus blown up viscus. So each one has its own percentages of infection rates, as high as 30%, as low as 1%. Most post-surgical nowadays, 3 days, they are being discharged. But these are all very arbitrary when you say surgeries, because there's all grades of surgeries. If you have an infection of the wound, if you notice that there is a possibility some of the sutures are kind of bursting, or you have developed fever, chills, rigors, which is all indicative of developing a post-operative abscess in the blood, or you have significant pallor or pain that is not expected post-operatively, there is significant amount of pain.